Let's begin with the first section of the lecture, and in this section we will discuss the epidemiology, pathophysiology of the burn wounds infections, and also the causative organisms that can cause infections of the burn wound. First, let's talk about the epidemiology. And in the epidemiology, many burn injuries are usually the minor injuries. They are not the major burn injuries. And in the minor injuries, usually they require very little or no intervention, or sometimes just a little home first aid treatment is that what is required. So usually they are minor injuries and they require little or no intervention. In 183,000 cases of the burn wounds are reported between 2002 and 2011. So it's about 183,000 cases of the burn wounds. Most of these cases are in the men, so majority of the patients with the burn injuries or burn wounds are men. They are they are maybe scalds, structural fires, flammable liquids and gases are the majority cases of the burn, and usually men who work in different chemical industries, different fire places, or close to furnaces, or firefighters, usually they are more prone to the burn wounds, and then that's why it's more common in the men. Burns predisposed to infection by damaging of protective barrier function of the skin. The skin is the first line of barrier that protects the body against different infections. So what happens during the burn? This first line of defense, which is the skin, is destroyed, it's lost, and that it leads to the loss of the protective effect of the skin, and it can cause predisposition to the infection caused by different microorganisms. So what leads to infection in the burn wounds or burn injuries? Loss of the skin, which is the first line of barrier, and then it can cause infection. Multi-organ failure and infectious complications are the major cause of morbidity in the burn patient. So as a result of infection due to loss of skin, which is the first protective barrier between the outside and the body, it can predispose the body to different infections, and then as a result different complications occur that can cause that increases the different morbidity, and also it increases the mortality rate as a result of burn, depending on the how bad is the burn, and if infection is bad and it can lead to septicemia, then usually it increases the mortality rate. And one thing I usually, whenever I teach this topic to the students, I usually have in my mind some very bad fear of the burn injuries, because I saw some cases of the burn patients really, really bad, and even continuous debridement and cleaning and daily dressings and treatments usually are not enough to treat those patients, and they usually die in a very, very miserable condition. So the most important thing is the protective measures we should take to avoid the burn injuries. Be very careful at homes while cooking. Usually the females, they don't take precautions. Try to use not the front stoves, use the back stoves. If the children are present in the home, try to keep them away from the stoves while cooking. So these are some important precautions we can take to avoid the burn wounds, because the consequences of major burn injuries are very, very, very bad. So this is the more common in men because they are handling the fire more, because they are handling the flammable liquid and gases, and also structural fires. And then the main reason for the infections is the loss of the protective skin as a result of the burn wounds. According to American Burn Association review, the pneumonia is in 4.6% of the burn patients, pneumonias occur. Septicemia is 2.7% of the patients develop septicemia. Cellulitis, traumatic injury, 2.6%. Respiratory failure is 2.5%. Wound infection occur in 2.2% of the cases. Also, some other infections is 2%. Renal failure in 1.5% cases. Line infection in 1.4% of the patients. Acute respiratory distress syndrome, 1.2%. So we can see a lot of different complications can occur as a result of the burn wound infections, and these statistics are according to the American Burn Association, and they show you how much percentage each infection is present in different patients who have burn wounds. Arrhythmias also occur in about 1% of the patients. Now the pathophysiology. Pathophysiology is of the burn is loss of cutaneous barrier facilitates. So I already mentioned the most important factor that leads to the infection of the burn wound is the loss of protective barrier, which is the skin. So loss of cutaneous barrier facilitates initially the wound colonized with gram-positive bacteria from surrounding tissue. So first, the loss of the skin barrier leads to the colonization of the burn wound with gram-positive bacteria from surrounding tissue. This is the picture of the patient who got the burn wound. So loss of skin leads to the colonization of the bacteria. Number of bacteria grows beneath the burn eschar, beneath the burn tissue, beneath the burn dead tissue eschar. Once there is colonization of the microorganism, they keep on growing and growing under the eschar or the burn tissue. If the bacterial count when reaching 8.4, 10 to the power of 3 on day 4 after burn. So loss of protective skin leads to the colonization of bacteria. They keep on growing, and on about day 4, a big number of microorganisms is about 8.4 into 10 raised to power 3 colony forming per unit are present. Avascularity of eschar favor bacterial colonization. So avascular blood supply to the eschar tissue or the dead tissue that develops as a result of the burn injury or burn wound further leads to the process of infection development. So all these factors, first invasion of the bacteria as a result of the loss of protective skin, multiplication of the microorganism or bacteria under the eschar tissue of the burn, and then later on as they keep on growing and there is decreased blood supply, avascularity of the eschar tissue also predisposed to the development of the infection. So this is very important pathophysiology, initial mechanism of the spread of infection in the burn wound. By the day 7 after the burn, what happened? Now wound colonized with other microbes. First we said gram-positive bacteria from the surrounding tissue. As the time progress, on day 7th there is colonization with other microbes. That's the picture you can see as the time passes. Gram-positive and negative bacteria and yeast, etc. now attack the burn wound. Invasive infection, localized or systemic occurs. So invasive infection occurs which can be systemic or localized. Role for biofilm recognized in experimental animal models. Streptococci and staphylococci usually are the predominant cause. And also Pseudomonas aeruginosa, major problem in burn wound management. So as the time goes by, on day 7th, besides gram-positive, now gram-negative and yeast infections attack the burn wound, and then it can be localized or systemic. Streptococci, staphylococci are the most common pathogens, and Pseudomonas aeruginosa, if it affects the burn wound, is the infection which is most hard to treat and most hard to manage. Next, in animal models of cutaneous thermal injury and infection with Pseudomonas, you can see this greenish, and then as a result of thermal injury, as a result of burn of the skin by the heat and infection with Pseudomonas. That's the diagram picture that shows you the Pseudomonas and the cutaneous thermal burn injury. Early steady increase of neutrophils in the skin. As a result, there is increase in the neutrophils in the skin. Bacterial dissemination to lungs and spleen occur within 72 hours. So it can affect the lungs and the spleen within 72 hours. And we already mentioned pneumonia is is the topmost effect of the infection of the burn wound. Pneumonia occurs and then septicemia. So once the microorganisms spread to the lungs and the spleen, it affects those organs. Use of topical and effective antimicrobial agents. Topical are the drugs which are applied locally on the skin. So topical antibiotic, and decline in the bacterial wound infection, and emergence of fungi, Candida albicans as important pathogens. Less common anaerobic bacteria are found in infections of electrical burns or when open wound dressing is used. So we can use the topical ointments which decrease the infection of the wound, and emergence of Candida albicans is a fungi that can occur, is emerge as an important pathogen. And less common anaerobic bacteria, anaerobic which do not require oxygen for their growth, they are found in patients who get the burn injury as a result of electrical shock or electrical burn, or when the open wound dressings are used. HSV or herpes simplex virus also found in burn wounds. So some viruses are also present. If the burn wounds are on the neck and the face, herpes simplex, and those associated with inhalation injuries, inhalation of different gases and different chemicals, as a burn as a result of that usually is associated with herpes simplex virus infections. Then we have CMV viremia or cytomegalovirus viremia. Up to 71% of seropositive burn patients, high level associated with high duration of mechanical ventilation. Other causative organisms that can cause infection, we have Pseudomonas aeruginosa, and I already mentioned infection as a result of Pseudomonas aeruginosa. They are hard to manage type of infections. And then E. coli, Klebsiella pneumoniae, Staphylococcus aureus. These are other microorganisms that can cause infection of the burn wounds. Independent of the percentage of total body surface area burn and full thickness burn, inhalation injury, day of death after burn. So they are free of all these factors, how much area is involved, whether it is full thickness or partial thickness burn, or what's the day of death after the injury. So they are not associated with any of these factors. Burn trauma patient with secondary Pseudomonas aeruginosa infections, fourfold greater mortality rate. Because of hard to manage the mortality rate, death rate is increased if there is secondary Pseudomonas aeruginosa infection. Acinetobacter calcoaceticus baumannii among top pathogens. Burn injury with ensuing hypovolemia and tissue hypoxia, followed by invasive infection arising from devitalized tissue. Frequency of infection, parallel extent, and severity of burn injury. So these are some factors associated with this infection. It causes hypovolemia, hypoxia, followed by invasive infection arising from devitalized tissue. Frequency of infection parallels the, so if the burn severity is more and the extent of burn is more, this is parallel, the more is the infection or frequency of infection. Severe burn injuries cause immunosuppression. So let's go over the chart and go over one by one the pathophysiology and how it can lead to infection, because severe burn besides the destruction of the skin, it also causes immunosuppression. The immune system is affected. It affects both the cellular and humoral immune system. decrease in the number and activity of helper T cell, increase in suppressor T cell activity, decrease in the synthesis and release of monocytocytes and macrophages, diminution in level of Ig follows major burns, neutrophil and complement functions impaired after burn, increased level of multiple cytokines, and there is wound infection and sepsis. So all these steps occur. There is decrease in the immune system, decrease in the helper in the number of helper cells, increase in the suppressor cell activity, and all these factors ultimately, as a result of release of different cytokines, cause infection and sepsis. Bacterial cell products are also produced that helps in the process, which cause bacterial cell products like pro-inflammatory mediators, increase the permeability of gut wall to bacteria and their components, immune dysregulation and sepsis, and burn patient predisposed to infection. So different pathophysiological phenomena are working in the burn patient that leads to the infection. Increasing level of vasopressin, aldosterone, cortisol, high level of glucagon, growth hormone, catecholamines, and other hormones, secretion of pro-inflammatory cytokines, natural killer cell activity is seen, and suppressor T cells are seen also in the burn patient. So this was all about the epidemiology, and we discussed in detail in this section pathophysiology and how the burn patient leads to sepsis and infection, and different microorganisms that cause infection of the burn wounds, and some microorganisms like Pseudomonas aeruginosa, they are hard to manage and the mortality rate is increased, and the main mechanism is the burn of the protective skin and also the suppression of the immune response that can lead to the infections and sepsis. Thank you for watching sqadia.com.